The birth of a baby can trigger a jumble of powerful emotions from excitement and joy to fear and anxiety. But it can also result in something you might not expect, such as depression. Most new moms experience postpartum baby blues after childbirth, which commonly starts 2 to 3 days after birth and can last up to a year in severe cases. Joining us tonight to discuss this is Dr. Nelson Makemba. Thank you so much for joining us, Doctor.
Thank you for having me on the platform.
In layman's terms, please just tell us what postpartum means, Doctor.
Yeah, basically, postpartum depression, by definition, is a complex mixture of physical, emotional, and behavioral changes, often that are experienced by mothers after they have given birth. Oftentimes, the first 4 weeks of having given birth, and of course, it then qualifies as a form of a major depression. So these behavioral changes that we often see are on the negative side, where the mummies are being, showing signs of being withdrawn and not feeling adequate and not able to bond well with their babies. Yeah.
Now, what are the possibilities that could take place during pregnancy that lead to postpartum depression?
Yeah, a lot of things can happen. For instance, if a woman do fall pregnant and maybe she's not getting the adequate support from the partner, that can be one of the things that can happen. And of course, if maybe a woman was raped, for instance, and maybe for one reason or the other, she didn't report the rape incident and just kept it to herself, and now all of a sudden she's finding herself pregnant, from this incident. If there was maybe an incestual kind of, a relationship where something happened in the family and the family is trying to cover up to protect the good name of the family. If a mommy is having a history of having had depression before, even if she falls pregnant, or there's depression problems that runs in the family. Sometimes when mommies go into labor, especially when they give birth normally, sometimes if the labor is quite complex, and maybe there is a significant, trauma experience, such as extensive tear that they can experience, a third-degree tear where the tear can extend all the way to the anal cavity. All of these things oftentimes do tend to then tip her over by the time she has delivered, that she might end up actually depressed.
Wow.
Yeah.
Now, how does one identify these symptoms, if they could have PPD, and who is really highly at risk?
Yeah, I think most of the time, of course, it's basically a depressed mood. They're feeling down. They got mood swing, outburst of anger. Mummies that feel inadequate. They are not able to bond with their child. They are not able to breastfeed adequately. They could be crying, withdrawn, not able to connect to friends or family. And of course, they might be suicidal, and they can actually go ahead and attempt suicide. And also thoughts of harming themselves and their newborn baby. So all of these things can play out, and they could also have problems sleeping. They might have loss of appetite, but also on the flip side, some people, when they are depressed, they eat a bit somewhat. So somebody might actually be eating excessively. And obviously, if you're looking at higher risk or candidates that are at higher risk of developing postpartum depression, it's mummies that have had anxiety or depression during the pregnancy. Right. Mummies that come from a low socioeconomic setting. She's now about to give birth, she's not working, she's no money, she doesn't know how to take care of her baby. As we have said earlier, if the relationship she finds herself in is not as supportive, meaning the partner that got her pregnant doesn't support her that much, that can also be depressing. If she generally have a low self-esteem, there's no social support, even maybe background-wise, the family doesn't really support each other where she emanates from. All of these things often play out then and place these mummies at higher risk of ending up with a postpartum depression.
Yeah. Now, we have seen some pretty popular stories in the local media about mothers who harmed their newborn babies, and you just mentioned some of the causes there. But are incidences of this nature always related to postpartum depression?
I think the challenge then comes in oftentimes when the mother has already acted out and caused harm to the baby, maybe just causing harm or even ending up killing the child. The society oftentimes doesn't always address these matters, the way they should be addressed, I should acknowledge, because now the whole thing is mirrored by the whole, mommy has murdered the child. Oftentimes, at that time people are only looking at the murder incident, and little care is taken to at least address the woman's, state of, health and her mental state. I would say by far a huge percentage is definitely rooted in postpartum depression. I should say also maybe perhaps from our side in the medical fraternity, we should be probing more, especially this mommy, especially when they've given birth in the hospital facility. Before we discharge them, we should make sure that they are in a right frame of mind. I know that sometimes our facilities can be very busy.
Right.
And of course, people also are good at putting up a front. You will think she's excited, she's happy, and she's, safe enough to go home. But if you don't probe enough, she could actually be having some depressed, moods going on there. So I think we should actually look very deep into that and make sure that we give this, especially young mummies, the best of services, so that we make sure that when we discharge them back into society, they're in a right frame of mind to care for themselves and their newborn babies.
And what are these services, lastly, Doctor? If you can just briefly give us where one can go for help, and what are these treatment methods?
Yeah, basically the treatment for postpartum depression is twofold. You got a psychotherapy, which is basically what we often refer to as talk therapy. With the psychotherapy, the mommy can be referred to a psychologist, and there's quite a good number both in the private and in the public sector, where she then sit down with a psychologist, aspects of, history taking, looking into her state of affairs, background, home, is she able to financially support the child? Then, of course, gauging into her mental frame. And when that has been established and perhaps a problem has been identified, she then can get counseled, so that she's able to get into a better space again. Then, obviously, also from our side as clinicians, we do then prescribe antidepressants. They are relatively safer dosages that can be given to a mommy, and she can take them safely to make and help her feel better, at the same time safely breastfeed her baby. Yeah.
Dr. Nelson, thank you so much for the time and also sharing the information on this issue.
It's a pleasure.